Welcome to the Health and Wellness Show. This is Paul Hambleton, and today we're going to be talking about sleep and sleep disorders. Today we have Ilya Dumov with us from the York Region Sleep Disorders Center. Thank you for being with us on the show today, Ilya.
You're welcome.
Now, before we begin about sleep and sleep disorders, I was looking at your biography, and it's very interesting. Could you tell us a bit about your area of expertise?
Our area of expertise is assist people and help people with variety of sleep problem. We will help them to diagnose the problem and assign the proper treatment. We are a multidisciplinary facility, which means that we deal with variety of sleep disorder. We are not just focusing on one. So at this point, we have a number of specialists in different area of clinical aspect of sleep medicine and a specialist in neurology, psychiatry, respirology.
So it's the whole spectrum that you deal with at your clinic.
Yes. In our clinic, our model allows us again. It gives us additional understanding of what people's problems are. If somebody, for example, has some problem with breathing at night and insomnia, so we manage to combine the treatment and deal with both conditions.
Great. So how did you get started in this field?
I did start with this field simply because I have an academic background in neurophysiology, or to be precise, it's neurophysiology of brain. So I have academic degree in this area, and I study electrophysiology of brain activity with various models. And one day I was at U of T, and I just paid attention for advertisement that they're looking for somebody who is familiar with electrophysiology in a sleep laboratory. It was very new field in late 80s. So I was interested in it, and I came for an interview and had a very interesting discussion with people who are not electrophysiologists and asked me questions about electrophysiology. At the end of our discussion, I believe they come to conclusions that I probably know what I'm talking about and decided to hire me. It's how I get into sleep.
Well, it sounds like you bring a very unique perspective then to this field. How long have you been active in the field?
Wow, it's 20-something years already.
A lot of experience. A lot of experience and situations have been accumulated over that period of time.
Yes, of course.
What type of services? What type of services do you provide then at your clinic?
In our clinic, we provide, first of all, interview for patients with sleep specialists. This appointment or this assessment, it's a one-to-one interview where physician, sleep specialists take patient history as a relevant condition, whole bunch of history on previous problem and definitely the sleep as itself. And in order to complete this assessment, we provide sleep testing in our facility. It's a sleep test, overnight sleep study in a lab where a patient has to come. Number of sensors were applied on the patient, and the patient sleep in the facility. If you compare with other medical testing, a sleep test probably is the longest test in clinical medicine regarding time which required to complete. Then study got analyzed, which take time too. It's quite technically complicated and extensive test when someone sleep in a laboratory and polysomnographic technologist monitors their sleep. And after analysis is done, the patient has a follow-up appointment with doctor. Doctor will describe what the finding of the test is and assign the proper treatment for patient. A few other follow-up visits might be required in the future for patient to complete the treatment process.
Sounds very, very comprehensive.
Yes, and it's a bit unusual again because people not used to, not to sleep at home, not just not to sleep at home, but people not used to somebody watching their sleep all night,
Right.
and whole bunch of sensors apply to people. So that's a skill of our team technologists to make people comfortable and fall asleep in a condition, because the objective of that overnight study to make people sleep.
Right. So now, moving on, snoring is an issue. What percentage of the population, men, women, children, would you say have a snoring problem?
It's about probably between 4 and 29% adult in men, and about between 3 and 14% of women, which increase with age, of course, and it's also increase depend on people health condition like obesity and stuff. It's making impact for that.
Mm-hmm.
For children, it's slightly different. Probably about 10% of more of children snore.
Wow, that's a higher number than I would have thought.
Sorry, it's a snoring. It's not. Yeah, the 10%. Yeah, sorry.
Okay.
Yeah,
Yep.
about 10%. But you can see regarding snoring, everybody snores at some point, right? There is
Right.
no. It's all depend on what that condition evolve and what impact it make for people alive, right?
Mm-hmm.
So.
And then it can get to be a more serious situation. And then two, I understand that there's a connection between snoring and sleep apnea. Perhaps what percentage in your estimates of the population, men, women, children, have a sleep apnea issue?
Sleep apnea issue. I mean, there is a famous, I would say, statement that the 4% of adult population suffer from sleep apnea, which is quite a lot. But to be more precise, it's probably 24% of men and 9% of adult women are suffering from sleep apnea.
Mm-hmm. Now that's broken down.
It's definitely more men than women, if you could see.
So in your clinic, it's mostly men that would have the sleep apnea. Not to say that women don't, but it'd be mostly the men.
You know what? Actually, I could tell you it's an interesting trend that we would discover. We didn't have a statistical analysis, but initially you've been absolutely right. I think like 10 years or so ago, most of the patients from the sleep clinic were men. But since sleep medicine get evolved and develop, we have quite a significant number of ladies who are coming for sleep test. It's a very, very interesting trend. I think it's because probably the public knowledge about of sleep apnea is get expanded,
Right.
and that helped probably women to pay attention to that category. Another thing, it's probably, as you know, the biggest concern. It's around the world, right? In North America, not the world. In North America, it's obesity, right? When obesity is on the rise, it's affect men and women also. And as obesity is pretty closely related to sleep problem. So at that point, if women's population get obese, then it's made an impact on prevalence of sleep apnea among population. Yeah, and lady pay attention probably more to their weight, right, than men at this point.
That's just what I was thinking. Some people believe that women, take care of their health a little bit more proactive than others, and so if they're aware of this potential condition that they may have, then due to the signs and the symptoms, then they'd certainly be more likely, or there's evidence that they're more likely to have that looked into and having a treatment or assessment done initially.
Yes, I agree. And I didn't mention you that men who come for the sleep lab, majority of them referred by their bed partners.
Right.
It's very common phenomenon. That's why sometimes when people come for interview, their bed partner or spouse are welcome because they could provide very important information about people's sleep, more than people themselves.
And a lot of people with sleep apnea don't realize that they have it, but as you're saying, the bed partner may be aware of it, and/or the bed partner may be the one that's helping to push the person with the problem to go get a sleep study and seek potential treatment.
Absolutely, that's correct.
So now with sleep apnea, there's 3 levels of severity of it, isn't there?
Yeah, we have 3 levels of severity of sleep apnea, and we have 3 different sleep apnea condition too. So what I mean by this, there is obstructive central and mixed sleep apnea, and this category could be also considered as mild, moderate, and severe.
Okay. So how would you treat patients with each of the different levels of severity of sleep apnea?
No, if we're talking, first of all, if we're talking about 3 categories of sleep apnea as obstructive, central, and mixed, is the most probably well known, and it's really happened in let's say population of patients. It's obstructive sleep apnea.
Okay.
A big chunk of all apneic, it's obstructive sleep apnea. And in order to treat obstructive sleep apnea, again, it could be divided by 3 categories, mild, moderate, and severe. And for mild sleep apnea, lately became a very popular way of treatment. It's oral appliances, loss of weight, some other device. It's like recently came appearing in the market called Provent. It's a nasal pellet. For moderate sleep apnea, there are all sort of surgical procedures available, along with continuous positive airway pressure ventilator, which help people to breathe at night. And for
That's
severe,
CPAP, right? That's
for
referred to as
CPAP, yeah, continuous airway pressure ventilator, CPAP. And for severe sleep apnea, CPAP is a treatment of choice. Considered to be there is a different modification of CPAP, like bilevel ventilator as well, but that's the most common way of treat sleep apnea. What I just important to know that this condition is treatable but not curable, and it doesn't have affect patient's life so much at this point. So people could use this ventilator at night and come back to their daytime activity during the day. So
so it affects they wear it at night, doesn't have any effect during the day, so they can have a regular, normal lifestyle during the day.
Yeah, exactly.
So we've talked about snoring and sleep apnea. I imagine you see a number of patients with insomnia. Do you have an idea about what percentage of the population has insomnia?
Oh, insomnia, it's a big, I would say, not only medical condition, it's a social condition. According to American National Sleep Foundation, about 48% of Americans report insomnia occasionally, and 22% experience insomnia almost every night. It's a huge number. It's a huge number of people who are affected by insomnia. Sometimes when you read this information, you couldn't believe it. It's real. Probably lots of people, deal with that at their own kind of, level, and not asking for help, professional help. That could be also important factor.
Mm-hmm.
But I believe that the situation with insomnia became more and more. I would say, describe in all sorts of public, presentation, documentation, because it's affect people tremendously, and it seems to be there is a program for people with insomnia get created, and more, way of treatment were developed, and it's recognized on all level, I think, of government even now, then insomnia is an important condition to deal with.
So let's talk about that a bit more. What are the ramifications of insomnia or sleep apnea if a patient has one or more of those conditions?
Uh, as you know, that sleep, as we discussed at the beginning, right, sleep, it's a brain function, right? And that point, sleep apnea or insomnia is affect people's ability to function on their mental level. What does it mean? People develop condition like a problem with memory and concentration. People became sleepy, irritable. People develop anxiety, depression, all sorts of mood issue, which definitely affect their day-to-day performance. And most important thing, it's a socializing aspect or communicating aspect with family member, with co-workers, with any other organization when people need to get concentrated, talk, to provide some information, to get some information. Sleep, if sleep is not in order, so to speak, it creates serious problem.
So if people aren't treated properly, it's a wide range of effects that this has.
That's true.
So if people aren't treated, what's the comorbidity of sleep disordered breathing then?
If we're talking about the sleep of breathing, if people have apnea, which is stop of breathing, it's making an impact all first of all to circulation. People develop hypertension. People develop some metabolic condition like diabetes. It could cause, it might provoke stroke. It could provoke any other condition which will not allow people to function properly, as I mentioned before, on a cognitive level. Cognition get affected. It's for sleep apnea. For insomnia, it's mostly patient's mood get affected, as I mentioned before, ability to concentrate, making decision, ability to memorize things get affected. And all way of communication between people who don't have insomnia and people who have insomnia might be affected as well. People became irritable, sleepy during the day. Sometimes insomnia has this condition. So it's a big impact actually in the whole society if people have sleep problem.
It's a huge problem, obviously, that affects so many different areas of a person's life, and it's the starting point to help to avert or remedy all these related conditions that people may have. So what amount and quality of sleep then is needed really for people to be functioning normally?
It's a very good question. It's all again depend on the people's age, and usually people in younger age require more time to sleep. Like children require 10 hours. When people get older, that number reduced to 8 hours and have 6 hours of sleep. And people in advanced age might require ever less sleep, like 5-6 hours. But it's all individual, and sometimes people with a kind of normal function require, let's say, 12 hours to sleep, and it seems to be like nothing wrong with them. They're just long sleeper.
It's just that's the way that their constitution is, that they need more sleep, and that's what it is.
What it is, right? And it's that kind of situation could be determined in sleep laboratory. But what is important, and I think we all know about that, sleep deprivation became a very important factor which people are dealing with in everyday life. You know, all of this advertisement on functioning certain businesses, offices, 24/7, you know, it's pretty common now. Whenever you go, whatever you hear 24/7, you hear it everywhere. Nobody kind of asks a question at which cost certain, let's say, certain organization could function 24/7. It means that people who work there work night shift, and night shift could take, very serious burden on people if it's not scheduled properly.
And being available by email or text or cell phone or what have you too, so they're on call, so that can cause problems as well.
Absolutely, and again, that's need to be taken in consideration, because sometimes people might think, oh, whatever, day, night, it doesn't matter. If I don't sleep at night, I could sleep during the day and catch up. It's not that simple. It needs to be proper schedule and adjusted.
So with all the problems related to a sleep disorder itself, plus all the other ramifications that are related to that, and then you add in all the complexity of day-to-day society, of the stress and the work hours and potential shift work, what is the ideal, proper sleep regimen? What does that look like?
I think the first ideal would be sleep regimen, and if I would say educational program at school, at university, and particularly in medical school, will pay more attention to education on sleep. We have now enough information, I believe, as a society, what people should know about to have healthy sleep. It's a very, I would say, wide range of topic to cover. But if we start with education and people will get used to pay attention to sleep, like some time, like people pay attention, to daily exercise, how people pay attention to their everyday routine for, breakfast, lunch, and dinner, sleep should find its way in people's life probably in the same level. And if it will be taking that way, it prevents people from all sorts of problems, which maybe they're not ever aware of. And starting with education would really help people themselves, and also help medical professionals who deal with people to work with educated people rather than people who come to the sleep clinic like we see it all the time, who have no idea what sleep is about and what needs to be done and how it needs to be done.
So that's part of what you provide at your clinic too. It would be education.
Yes, absolutely. We try to do our best, but again, as a clinical facility, we're limited to services which we could provide. It's the people's responsibility themselves to really get into this or obtain certain knowledge. In today's world, when there's so much information available on internet, it's not difficult to do. People just have this understanding and ideas that they need to learn certain things.
Mm-hmm. So now, if someone were looking to visit a sleep clinic such as yourself, what should they know? What should they look for?
First of all, before people go to sleep clinic, I would suggest them to get some information about what the sleep clinic does. If this clinic could help them with the problems they have, they could look at the web page, they could read some maybe handout and leaflet, they could ask other people who might visit at this clinic. Because sometimes, the sleep problem as they so could be vague and non-descriptive that people come for help and they might not be able to get the sleep in certain clinics. So they need to do search to make sure that the problems they have could be addressed. Most of the sleep clinic in North America deal with sleep apnea. It's understandable. It's the most common condition. But if people have chronobiological problem, if people have insomnia, if people have something else which is not a sleep apnea, they have to really check carefully if this particular clinic will be able to help them. It's also would be not bad for people to get a little bit more educated about sleep because the most common question when patients come to interview for the clinic, like for how long you have this problem, how you could describe this problem, what your usual sleep pattern day to day is, are you working shift work, are you taking some medication which might affect sleep, and so on and so on.
That's great advice. Now, if listeners would like to get in contact with you, how can they do that? What's the best way?
The best way, we have a website. Our website is www.yorkregionsleep.com. And website, people might get some information, first of all, about certain sleep condition, and they also get some idea how to get an appointment in our clinic. They also could call our line, but our line is busy, and people need to be ready to wait some time, which in today's society, as we know, people don't have patience. But website could probably give them enough information. They also could email us. Our email address is info@yorkregionsleep.com.
Terrific. Well, Ilya, I'd like to thank you very much for being on the show today and providing us with great amount of insight based on your expertise over the years. Once again, thank you very much for being on the show.
Thank you for having me.
Okay, our pleasure.